This story reflects one person's experience. Not every person will receive the same results. Bear in mind that all surgeries carry risks. This treatment is prescribed by your physician and is not for everyone. Please talk with your doctor and see if it's right for you. Your physician should discuss all potential benefits and risks with you. Important safety information about the X-Stop spacer appears at the end of this video. For additional information about this product and treatment options, please visit www.xstopspacer.com.
I've led a busy life.
For years, 67-year-old Pearline Harmon led a full life as a mother, wife, and full-time college librarian.
I love being in the public with people, and that has always been my job.
But just over 5 years ago, chronic back pain dramatically slowed Pearline's active lifestyle down.
I just couldn't walk. If I walked, it was painful from the waist down. The pain became more intense. I couldn't stand for any length of time.
She could only take, I would imagine, about 10 or 12 steps, and she'll have to sit down. I would joke, I said, are you breaking down on me?
Even the simplest tasks, from gardening to doing the dishes or just grocery shopping, became unbearable.
I would hold on to the cart to help me. I found that if I did lean over, it did assist me in moving further or longer.
When we bend forward, such as leaning over a shopping cart or sitting down, that flexion motion opens the spinal canal to give the nerves a little more room, and that is enough room to relieve the pressure.
To help relieve the pain, Pearline tried epidural steroid injections and over-the-counter medications, but the relief was temporary.
I sort of had given up that I was just going to have back pain, and I gave into it and just endured it.
But Pearline could no longer endure the pain while she worked as a librarian. In 2008, she retired.
My greatest fear was that I was going to have to end up in a wheelchair and could not walk at all because the pain was so bad.
And Pearline had one other fear, undergoing invasive surgery like a laminectomy to treat her back pain.
I didn't want the recuperation, I didn't want the rehab if I had surgery. So I had just made up my mind I was going to have to sit in a wheelchair.
And you can see the area of stenosis there and there.
Pearline was running out of options when a friend suggested she see Dr. Grant Skidmore, a neurosurgeon based in Norfolk, Virginia. His diagnosis? Lumbar Spinal Stenosis.
Spinal stenosis is narrowing of the spinal canal where the nerves travel. They don't have the freedom, and they're much more readily irritated. And the spinal stenosis typically results in pain that radiates from the back into the buttocks and legs.
Let's take a look at the X-Stop, and it preserves the motion of your spine while limiting the extension.
Dr. Skidmore thought Pearline would be an excellent candidate for an innovative device called the X-Stop spacer.
X-Stop is called X-Stop because it stops extension of the spine. And it's extension of the spine that pinches the nerves. When somebody stands up and walks around, there's more pressure applied to the nerves at the stenotic level.
The X-Stop is implanted between the spinous processes and is designed to keep the space open so when a patient stands up, their nerves are no longer pinched. And a key benefit for Pearline, the X-Stop is a less invasive surgery.
I felt comfortable about the X-Stop mainly because I wasn't going to have to stay in the hospital. I wasn't going to have to go through rehab. I could go back to doing the things that I wanted to do.
Pearline couldn't believe how much better she felt just hours after the outpatient procedure was done.
It really hit me that my back was not hurting the day we came home from the hospital. It felt good. I couldn't believe it.
I like what I saw. Once she came home, it was old Pearline again.
While Pearline received satisfactory results, it's important to note that all spine surgeries carry risks. The X-Stop spacer may not be right for those with certain allergies, spinal anatomy, or severe osteoporosis. Approximately half of patients studied achieved treatment success. It's been just 6 months since Pearline had the X-Stop implanted. Now walking is a pleasure. and she's amazed how relaxing it is to work in her garden. Pearline even exercises 3 times a week.
It just made me feel like maybe I shouldn't have retired.
Pearline says thanks to the X-Stop spacer, she and her husband can truly enjoy their retirement.
I consider it a gift.
I would say that the X-Stop has given me back my life.
For more information, visit xstopspacer.com or call 866-581-2717.